Good afternoon, ladies and gentlemen. Welcome to this breakout session of the second MAP Next Gen CEO Web Conference. I am Donna, President of UBE Media Inc. And this breakout session, The Good Lifestyle, this is the third of this series. And this afternoon, we have Dr. Gap Legaspi, the Director of the Philippine General Hospital. So please settle down comfortably. We will now begin our program. Some reminders. Please, before we proceed, as participants for this breakout session, you are automatically muted and your camera video is also switched off. Audience in the Echo Hub platform will remain muted. However, you are encouraged to submit your questions through the chat box. Due to time limitations, we may not be able to have all your questions answered live. And lastly, for our audience, you will only be able to see the speaker and moderator and will not be able to view the other participants. In line with MAP policy, we will dispense with the lengthy introduction of our speaker. So our speaker for this breakout session is expected to share with us his views on how next-gen CEOs in his industry or sector should lead their businesses to be innovatively profitable, socially responsible, and environmentally respectful. I would like to remind our speaker that you are given 20 minutes for your presentation. So may we now call our speaker for this breakout session, Dr. Gap Legaspi. Hi, Doc.
Thank you very much, Donna. I'm happy to be here with you. I'm ready to start. I'll just share my.
Yes, we're very happy that you're here amidst your very busy schedule. So, yeah,
Let me just share my. Sorry. Okay. I don't see my screen. Sorry.
okay. We're just setting up Dr. Gap Legaspi's presentation. Is it coming out now?
Is my screen?
No, not yet. Uh, so please.
I'll stop sharing and then I'll try again.
Okay. Hold on, everybody. This is going to be the session that we are really most looking forward to. Okay. Please switch to the presentation. Yes.
Oh, sorry.
Is it working now?
I can't seem to share my screen. Sorry.
Okay. Doc, you also have your presentation also with the tech team, right? So they can also share the presentation.
Um, I don't think I sent it. It's not coming out as it should.
Maybe we can try sending Doc your presentation. And the people at this plenary, please hold your questions while we set up some tech.
I'll just.
Is it coming out now?
Sorry, I don't see it. Wait, let me just yeah, quickly.
Because we can reset or otherwise, we can have our discussion and we can share your slides after while you're
Uh,
setting up, Doc. So, while Dr. Gap Legaspi is setting up, let me just share with you what Dr. Gap has been doing for the past year. As we all know, Dr. Gap was the first legally vaccinated doctor here in the Philippines, showing everybody how it's done, while, of course, ensuring that the doctors, nurses, and all the healthcare workers were actually very, very safe in their hospitals. So we're going to be taking a look at that and how Gap managed to do that during the pandemic, and it's still the pandemic right now. And he also came from back-to-back conferences today, I gather. He just came out from one, so hopefully he'll be able to share us some of that as well on how to improve ventilation in hospitals. And while we're waiting, please craft your program at madami tayong matatanong kay Doc as he's a so sought after doctor as we've had in the backstage as well. So, Doc, is our tech okay?
I'm sorry,
Not
I'm
yet?
losing everything. Wait,
Okay. Let me ask our technical director how we can go about this.
yeah.
Otherwise, we'll have to have a conversation and hope you can share your slides. We can do it that way. So,
Okay, maybe we can do that. Maybe we can just do the question and answer first, while we're figuring it
all
out.
right, Doc. While if you can send the where we can do it reverse, and then you can take through the slides because as we've discussed, right, some of the questions that I'm asking is actually part of your presentation. But if it's possible that you can email now first your presentation deck to our tech team, and they can manage to um, what do you call this? Broadcast it from their screens. So there. So Dr. Gap Legaspi. So finally, I'm the one who said hello to you at the market, remember?
Yes. um,
Yes.
this worked yesterday. Sorry about that. We had a, I don't know how I lost the sequence there. But,
Okay. So we'll just start first with some Q&A and hopefully we'll get through your formal presentation as well because I know you prepared very, very hard for that. So we're gonna go um, well with my prepared questions for this afternoon. So, Doc, we're quite at a relaxed state. And as I mentioned, we're going to talk about later also. But since I preempted my question, that si Doc nagde-day off din siya. So, since he's Dr. Gap Legaspi, he happened to go also to the Legaspi market. Yes. So I'll start with that, Doc, and then later on, yeah, your formal presentation. We're very, very interested in hearing that. But now that we're at the pre-Delta levels in terms of cases, what should we keep on doing to ensure that it stays this way?
so we just experienced the worst surge ever since the COVID started last year, and it was because of the virus mutating to a more virulent form in terms of being transmittable and highly transmittable and highly and causing more severe uh, illnesses. So I think it is very obvious that it is now accepted that the virus is transmitted via is airborne, and the best way to combat this is to just keep wearing our masks. We can probably take do away with the face shields, but not the face mask. So we continue practicing our minimum health protocols, the mask being the most important. I always tell my kids, if it's going to be a very close space and a lot of people there, I would rather that they level up to maybe a KN95, um, which is a higher blocking capability than a surgical mask. So that will give offer better protection in areas where there's a high concentration of people and very poor ventilation of that.
Okay, thank you, Doc. And since our theme for this year's conference is the Good Next Gen CEO, during the height of Delta, Doc, where there was really like a surge of patients, cases, how did you manage the everyday, or how did you, even not even Delta, but how did you manage the year, this once in 100-year event for society?
Well, of course, just like all of us, just like all of you, it stopped us dead on our tracks. No? PGH is a 1,500 bed hospital. Uh, we see around 700 patients a year, and we have 4,500 employees and 4,700 trainees. No? So there's a lot of people in the hospital. And when Delta came, it stopped everything, dead on its track. So it was really a matter. It was really a balance of responding to the COVID infection, to COVID crisis, and trying to maintain the operations, the usual events or activities happening in the hospital, which is really related a lot in a lot of way to non-COVID activities, non-COVID patients. But unfortunately, we were overrun by COVID, and the hundreds of thousands of patients that we used to see are not around anymore. So, in a way, we had less patients, but the weight of taking care of COVID patients was three times the weight of taking care of ordinary patients. So it really took a big toll on the system, on our finances, on our supplies, on the morale of the people, and so it was a it's a daily problem solving. No? So sometimes our policies, our protocols changed every 4 hours at the start of COVID until we got to have a slow, understanding of what worked and what did not. I think it's only after 2 months that we had a semblance of a routine every day. But for the first 2 months, it was really touch and go, no? Daily adjusting and daily calibrating of our intervention. So we have had to do a lot of infrastructure changes, improving our ventilation, taking advantage of the open spaces that we have around our hospital, and also, of course, making sure that our healthcare workers are well accommodated in their um um, hotels and in their dorms. No? So the other thing that we had to do, because there was no transportation available, was that we had to hire shuttle buses for our healthcare workers, and that costs a lot of money. That really, as I said, affected a big way our financial balance. But it was a necessity that was well received by our. It was necessary intervention. It was well received by our employees. No? I think providing the shuttle service was the one that made them more confident of going to work, because according to them, they knew who was with them in the bus. They knew who was careful with themselves or careless, unlike if you're in a public transportation, if ever it was available. So on a day-to-day basis, this had to be taken care of. At the same time, we were projecting every day the day that we're going to open for other services. No? So I mean, as the director of the hospital, I think the biggest job that I had to do is reading the signs. I mean, anyone managing an agency or hospital like PGH should have his eyes always open to the signs, and trying trying to make decisions, hopefully the right decisions based on the science that you get every day from the information that is going around.
Okay, so Doc, for our listeners out there, our next gen CEOs, Dr. Legaspi just gave us a very good tip, whether you're a doctor and entrepreneurs, to be able to read the signs literally and figuratively. And before we go to the next questions, Doc, the PowerPoint switch is, I think, okay. I think we can go to your formal presentation to click share, then share screen. Then instead of entire screen, click on window. Is that still manageable?
Okay,
Yes, we're on a different platform, so
there.
we're
Sorry.
adjusting to that as well. Yes,
So is it, you can see it already?
not yet. Click share, then share screen. Then instead of the entire screen, click on window.
Okay.
So for those who just stepped into this breakout session, we are talking to Dr. Gap Legaspi, the director of PGH,
Is it?
and
It's
we're
not up.
no. There you go. But where did you go, Doc? There. Okay. So
Okay.
I'll let you do your lecture.
Okay. Well, I think my topic for this afternoon is the good lifestyle. Maybe the message here is that to take care of others, I think we have to take good care of ourselves also, and maybe find a ways on how to do this. But I have to make a disclosure that I'm the worst example for a good lifestyle. I've been a neurosurgeon for 30 years. This is my job. I do surgery, and my line is aneurysm surgery. And if there's any surgery in the brain that's most stressful, there's nothing more stressful than an aneurysm surgery, just like the one you're seeing on the screen that ruptures during the operation, and you have to make ways on how to control it, uh, while keeping your cool. I think this is what managers should do. They anticipate problems, uh, going to the situation, like going to the OR, ready to having imagined the process in their mind and having imagined the interventions that need to be done. The steps are actually in your mind even before the events have happened. I think in my surgeries is what I have practiced all these years, and that served me well, and gotten me out a lot of very tricky situations. So um, I've been a neurosurgeon for 30 years, and as I said, I'm not a good example of someone with a good lifestyle. I used to burn both the candle on both ends, doing surgery, teaching, of course, hanging out with friends, doing my extra activities outside of my work, until I decided to slow down when the signs were showing. So, and all of that was related to my life, to lifestyle. And lifestyle, as a good student, I googled it. It said that it's the way in which a person or a group of people live. And we all know the variables that affect our lifestyle. No? What we eat, how we take care of ourselves doing exercise, how much sleep we get, the kind of behavior that we practice, whether regular or deviant, can all take a toll on our lifestyle, and eventually our health. Of course, abuses of medication substances, and of course even of modern technology. So we try to adjust to the different demands in our lifestyle by activities like being creative, and of course continuing to be mentally challenged by studying or continuing further education. And all of this contribute to the key um, to a healthy lifestyle. And as we continue to uh, uh, adopt a lifestyle that is of our liking, no? Of our choice. I was intrigued by this study by Horley et al. That in the younger population, it's probably a lot of you. No? They observed that the lifestyles that they chose were those that were, really taxing on the human body and on health eventually. No? The four types of lifestyles that may be self-indulgent in the very young, and as we grow older, it becomes less self-indulging, more of risk-taking, and then more of proving the independence and self-reliance of the person, and then eventually being creative and innovative. So I myself have probably gone through some form of this evolution of my lifestyle, and just to mention it, I'm just mentioning it for you to be in the right perspective. And we adopt a lifestyle that we hope, as I advised you earlier, that we take care of ourselves to take care of others. So adopt a lifestyle that brings us to good health, and health being not only the state of being free from illness or injury, as Google describes it, but actually a more complete definition of health is a state of complete physical, mental, and social well-being. And it does not describing merely the absence of disease or infirmity. So it's a total picture of the different aspects of our lives that give us a sense of well-being. And the WHO says that 60% of related factors to our health and quality of life are correlated to how we lead it. So there's a 40% influence by non-modifiable risk factors, such as genetics. So I think maybe some of you will notice that even if you do your triathlon, even if you bike weekly or even thrice a week, your cholesterol is still high, because that's how God made you. Not the genes that give other people a very good metabolism of fat may not have been given to us, including myself. No? Whatever I do, my cholesterol, I cannot bring it down below the high maximum that there is in the laboratory test. So we can probably just pray that the 40% of the non-modifiable risk factors that God gives us will be the good one. So as I said earlier, the personal health is not only physical, it's all the emotional, social, and spiritual. So this intellectual health that we all aim for, but sometimes easily forget. No? For all of you managing businesses or being in a very busy practice, like I was and still am, and also with a lot of concerns, it's very easy to miss out on these different aspects of our health. But as a reminder again, when we sit down and have our quiet time, just remember that the balance of all of these five aspects of personal health is is important for us to maintain it as well as we can. So the as I was preparing for this, I was going back to how I've been managing my life for the last 30 years as a neurosurgeon, and I think it boils down to a very interesting read that I article that I chanced upon, which is energy management. Energy being our ability to do the work for the day. No? And energy is a limited resource generated from everything that we have acquired through the years. No? Experience, resources, ability, talent, no, and our styles of doing things allow us to mount up an energy which is like time. It can be used properly, but is not unlimited. So the factors that affect this will be, of course, the age which I'm now experiencing. Although I probably would like to say that I have the same energy that I had when I was 40 years old. Maybe it's my mind just saying that, but I'm starting to feel that, and it's not bad to realize that you have to adjust to that. No? You have to accept it so that you don't use the limited energy that you have unnecessarily by doing so many things at the same time. No? Like what you did when you were younger. Sleep definitely is a factor in giving you more energy. The stress levels that you encounter every day, your medical condition, and of course, as I said, the lifestyle that you lead, all are big factors in allowing us to have the ability to do whatever we need to for the day. And it's really a balance of what we put in as energy deposit, and what we withdraw from it. So it's a daily balance of in in and out of energy, and I think what we feel at the end of the day is the end product of a positive or a negative balance. So of course, we all want to have a positive balance at the end of the day. And there's some interesting steps that were proposed to increase the energy and facilitate the conservation of this energy if there's not too much. No? One is, of course, uh, a well thought out meal, which is nourishing, which is which we like, and which gives us a good feeling afterwards, which is also, of course, a balanced meal that we can sustain on a day-to-day basis. And it has been proven that the micronutrients that we take from food, from a balanced diet, is sufficient. No? We don't have to take extra vitamins, which are probably marketed wrongly uh, by a lot of companies. No? So eating nourishing food would be the first step to try to to have a chance to increase your energy that you can use for the day. Um, it has been a well-known fact that sleeping 7 to 8 hours a night is the optimum, is the sleep that gives us the optimum performance during the day. Not only performance, but also the protection of the brain from dementia, from Alzheimer's, and the heart from coronary artery disease. No? So sleep truly is an important part of maintaining a good lifestyle, promoting health, and of course giving us the energy to do the things we need to do for the day. But having said that, I think again, I'm guilty of having a very little sleep. Um, for the last 30 years, I guess, averaging only 5 to 6 hours a day. But that's me talking. No? One of the things that I think I have also learned to do during the my career and personal and academic life is I now try to surround myself with the people that I like. Keep company with good people. I try to avoid negative people now, which I wanted to be with in the past because I wanted to engage them. I wanted to debate with them. I wanted to prove them wrong. But as time passed, I told myself maybe it was not worth all the trouble of doing that. So it really helped. In the as I said, as I age, my energy probably level is not as high as before, but I'm able to conserve it by avoiding the negative people that I used to surround myself with. So this is very important because um, the our ability to deal with all kinds of people is an important part of being managers or being CEOs. and we just have to protect ourselves also from this. Sometimes it's unavoidable, but I think you learn through the years on how to adjust to this. The current um, explosion of social media information uh, being bannered as truth, um, or even news at that, is causing us a lot of stress and draining us of the energy that we need for the get us through the day. So it is advised in that article that we choose what type of information we let ourselves access. Don't let it be a random reading of posts or articles or news, because as we especially nowadays, it's so almost all negative news, um, and all conflicting also and confusing. To be to be honest with you, I don't have any Facebook account. I don't have Instagram. I don't have Twitter. I only have email, which I can control at least. No? Even email, sometimes I get overwhelmed. No? So we have to, in our own way, be able to discern the type of information that we let ourselves access. And then, of course, regular exercise. Has been proven again in a study uh, analyzing mental health as well as brain function. Regular exercise of around 150 minutes a week, not necessarily strenuous, just moderate, is much better than no exercise at all, because although you exert effort to do the exercise, it actually with the endorphins that it releases and the improvement in cardiovascular status, you're able to gain more energy and generate more energy to do more things. No? So of course, if you overdo it during the day, um, uh, beyond your usual feel good level, you have to pay the price during the rest of the day. When I was younger, I couldn't start the day without biking in the morning. Now I find that very difficult to do, because if I bike my usual in the morning, I will not have enough energy to finish my clinic in the afternoon. So again, this is a balance of what you're capable of doing or not. And then the there's this concept of mindfulness, and which brings us to thinking of what we do during the day, and thinking of the meaningful ones that we do that gives us a good uh, a good sense of well-being, which increases our ability to uh, do things again. So empathy to other people, helping out other people, even if we ourselves need help, is very liberating. So um, I myself, on a daily basis, I experience this with patients, and it's something that probably difficult to explain if you're not a doctor. Not no matter how long the surgery took, as soon as you come out of the operating room to talk to the relatives and see how thankful they are, it's as if you're just starting your day. That's how it felt. I remember my longest surgery was 25 hours, and I was starting my practice, and talking to the relatives at the end of the 25 hours probably diminish the fatigue by more than half already, with a very grateful family that I was talking with. So you identify those events or those activities that really give you a good feeling, and most of the time this is what is but in the situations that will be of help to others, and try to take advantage of the feel good moment of those activities. And then, of course, thinking of good thoughts for others is a positive, gives you a positive feedback and an unexplained sense of fulfillment and peace. No, so so all of this in combination, if you're just mindful of them every day, hopefully will allow you to sustain a even a busy schedule for the day with the energies that you generate and conserve with this intervention. So there are some simple activities of self-care, no? That you may employ. First, you have to know your energy level, or you have to know if you're tired or not, and you have to know the people or events that make you tired or not. So, during the whole day, you try to assess yourself if you're um, draining your battery with the conversation that you're having with these types of people, and maybe you can do that very early during the day, and those that do not affect you too much, have that during the end of the day when you have a bit more tired, and doing activities that require less energy. So we also make incremental changes. After knowing what drains of your energy, you choose the areas that are important to you, and work on them while you still have that energy. You compartmentalize your work. Let's say in a house, in your house, if you have decided to clear the clutter, don't clear the whole house at the same time. Clear one room maybe, and then the next and the next. Very much like the technique that Napoleon Bonaparte himself did. He compartmentalized his work. Uh, he Because of that, he was able to establish the first finishing school for women in France, set up the aqueducts around France, and also start the financial banking business of France while fighting his battles. The assessment there is still able to compartmentalize all of this. And of course, to be able to manage your energy, you plan and prioritize. No? As I said, take note of the highest energy level you have during the day. Some of us will have it in the morning, some at lunch, some in the evening, and then you just plan your day around that, no? And prioritize important tasks when you're fresh and productive. So living this healthy lifestyle is done by doing what is right for your body. And long life is not necessarily healthy, but long life is really not a factor of health alone, but also a factor of social interaction. A study of Okinawans and Italians, comparing them to those found in let's say Italians in Sicily and Italians in Brooklyn, found to have had the same lifespan. They thought it was the food that they ate, but it's really more of the same social structure that they had of an extended family. And Okinawans as well, they thought it was the food that they ate, but it was really being with their family the whole time that the researchers concluded was the biggest factor in longer life. So, us being social animals, have to be aware of maintaining healthy relationships with others also. And in leading to that, just to round up the lecture, we cannot be healthy by ourselves. We have, for all of those of you maybe in public health or in some other businesses or activities related to it, just like to segue to a national scale of health, which is our public health. And this pandemic has shown that our population grew faster than our hospital bed capacity. That's why people experience all of this lack of facilities when it was needed by a lot of our countrymen. So we have neglected that part of hospital health development, which is hospital development, such that our bed capacity is comparable to the low-income countries in the sub-Saharan Africa, Laos, no, and the rest of the countries poorer than us. So it's just a matter of misappropriation of our priorities. And one example of a priority that was that we insisted that we develop the Philippine Genome Center, which was overlooked for a long time since the 1980s, was only attended to in the late 90s and early 2000, gave rise to a highly specialized service called the genomic sequencing. And this is what gave us a lot of information about this coronavirus. Just imagine if if a lot of other technology that we have not given attention to, which we could have used in battling this pandemic. And also, as a matter of health for our countrymen, I think concentrating on hospitals is not enough. It's even more imperative to concentrate on the community, no? Because in primary care, where 80% of our healthcare is done, we are able to do all the interventions, whether COVID or non-COVID times, where the um, effects are more crucial and more critical in keeping our population healthy. No? We could have exercised home care, contact tracing, and vaccination easier if we had a good primary care system before the pandemic. So I guess this is what we should be concentrating on now. Um, from the level of the barangay health workers and units to the LGU hospitals, and everything in between. I think we have to start concentrating on those in preparation for any other future pandemic. Because as we manage healthcare, we realize that only 20% of healthcare actually is accessed in hospitals. No? 80% of them have something to do with socioeconomic factors, which are all which we can all intervene in. No? Community safety, income, job status, family and social support, and education. Now, these are interventions or problems that we can take care of exactly where we in the areas where we live. No? There can be traced back to where you live, your zip code. No? And then a part of it will be the physical environment where we stay or we live that surrounds us, and this can also be interventions can be done to improve this, and of course education to improve health behavior that relate to abuse of, as I said, substances and tobacco, that allows us to engage in activities that improve our lifestyle and health behavior, all constitute around 80% of the intervention that we can do outside of the hospital. And as managers and CEOs, we have the ability to do this for the public through our employees. So, in that 80% of the population, that is by keeping your companies oriented to a good lifestyle and keeping your employees healthy and literate, you are doing already most the majority of the work for keeping our people healthy. The 20%, let those of us who are in the hospitals take care of that. So thank you very much, and I'm now ready to take your questions.
Thank you, Dr. Gap, for sharing that brief lecture on having a good lifestyle that translates to our personal responsibility actually amounts to 80% of your good health, and the rest would be 20%, right? We only have one more question if we have some questions from the panel. We're okay to take that, but just coming from Doc, what you said earlier in terms of leading a good lifestyle, you've said earlier some disclosure as well that this is the ideal, but the reality is it's quite difficult to do that. So from the 10 of the stuff that you can do as a good lifestyle, what's the number one thing that well, you already mentioned, right? Nutrition. But if they're not yet doing that, what's the easiest way? As right now everybody's in a variety of diets, and then you mentioned the Okinawan diet, but it's not exactly the diet, right? It's like the people that you surround with.
Yes.
So
So
how
the
do you
bottom
get to
line actually
realizing
is,
that?
yeah. So actually the bottom line really is feeling happy around your surrounding yourself with happy thoughts and happy activities that make you feel good. I think that's basic technique for keeping yourself healthy. because all the rest will follow. If you have enough energy to do exercise, then you do your moderate exercise. As I said, not necessarily an extreme sport or exercise. The minimum that we have to do is find the activities that make us feel good, and as I said, sustain us with the energy that we need for the day.
Having said that, Doc, you mentioned earlier when before you started your presentation, right? You had to do a lot of like managing people and managing the hospitals and the morale of your nurses, doctors, and staff. How did you manage to maintain morale while keeping your lifestyle and everybody's lifestyle in the hospital and all of that intact? Especially during the height of the crazy days. Now we're kind of like normal, and then I'll follow up with that because we have a few minutes. How do we make sure that we're gonna have a Merry Christmas, at least for 2021?
Okay. I must confess that it was, we almost exploded at the start of the pandemic, because I was running it like a general in a war. I was giving out orders. Of course, as I said, being the manager of the war, I had to read the signs and employ the necessary strategies, and I had to give orders. At the start, it was all just like a general giving orders to soldiers, not realizing that your every word or every command entails a lot of takes a big toll from the doctors, from the nurses, and it's only when I sat down with them and talked to them and got their opinion on how to do things that we started to gel together. I think that was around the third or fourth week of the pandemic. It was really very important that they became partners rather than soldiers in the war. No? So they became partners in a cooperative, I would like to call it. That we before we instituted any intervention or any protocol or any change, we talked to them, and then we had this basic technique that we had when we thought of changing something. We will tell ourselves to let it brew first, let it brew, let it sink in, let it let it get passed on to from employee to employee until everyone is living it out on a daily basis. So maintaining the morale entails a lot of a very complex process, no? And it's all centered on mental wellness. So it's not enough that you give them monetary incentives, no? Because the government gives this left and right. I think it's really the sincere effort to show that they're important, that what they do really matters, and that I think one of the most effective intervention that I did this was I put on PPEs and went to the wards with them. I I I did my duty in the COVID wards. So I guess being one with them boosted their morale, and from then on it became easier for us.
Well, Dr. Gap Legaspi, thank you so much for sharing that. So, for the next gen CEO, take it from Dr. Gap, who's right in the middle smack of the war, but simple things just in your last statement. You really need to talk to everybody and get their sentiments, and there you can arrive at a better decision and better course of action. And of course, his health and lifestyle tips that we should all follow to help our community and our country get over this pandemic. So thank you so much, Dr. Gap, for your
Thank you.
time.
Thank you, Donna. Thank you very much, and good afternoon to everyone.
Okay, maraming salamat po. So we can go back to the plenary right now. Thank you so much. I'm Donna, President of UBE Media for the Good Next Gen CEO.